This is Dr. Kristin Titko at the Center for Foot Care, and today we're going to talk about bunions. There's two different types of bunions. One is the bump that sticks out on the inside part of your foot, right behind your big toe. You'll see this associated with the drift of your big toe towards your second toe. The other type of bunion is called a dorsal bunion, and that is when there's a big bump on the top of your big toe joint. Both of those are hereditary, although the second type, the dorsal bunion, could be brought on by an old trauma. Bunions are hereditary, usually carried by the female, so mom, grandma, daughter are going to get bunions. Sometimes it skips a generation, but don't count on it. What we do know is that bunions are not caused by shoes, so you can give up the guilt of you wearing those fancy shoes when you were in your 20s. Now, we can get a bunion when we're a juvenile as well, but it tends to happen between the ages of 30 and 60. As the big toe moves towards the second toe due to a muscular imbalance, the bone behind the big toe moves in the opposite direction or towards the other foot. And you have this bump on the inside part of your foot that tends to be very uncomfortable in shoes that just aren't shaped like that. The longer your deformity is present, the more out of alignment your joint will become. And just like your car tires, when they are out of alignment, they wear and tear irregularly. In this case, with the bunion, we develop arthritis in that joint that's wearing irregularly. So you can have pain from a bunion either on the bump that sticks out on the side of your foot or deeper inside where the joint is going through its wear and tear process or arthritis. Both are treatable, and in many cases, even without surgery. Now, the bunion deformity itself will only go away with surgery, but if you're looking for pain relief, you now have options. Sometimes it's just being educated on where or how to go about buying your shoes. Sometimes anti-inflammatory medicine like Nuprin, Advil, Aleve can be helpful. There are prescription strength anti-inflammatories that you can take that can be prescribed. Sometimes we'll inject some medicine to help decrease the inflammation in the joint. We now have a new laser available that has a 90% success rate in controlling and maintaining the pain from your arthritis. This laser works to reduce the swelling, the pain, and the inflammation of your bunion. And in more advanced cases, particularly if your bunion is keeping you from doing those activities that you'd rather be doing, then surgery can be done. The second type of bunion deformity, that dorsal bunion that we talked about, what happens in that case is a bump will form on the top of the joint due to the mechanics of the foot, and this bump enlarges over time. As the bump gets bigger, your big toe can't move up over the bone behind it. So when you go to take a full stride, your big toe just won't bend, and that can be very painful. Sometimes it's as simple as putting a custom-made insert into your shoe to help your body think that that joint is working better for you than it is. Again, sometimes we can use an injection. Our laser therapy is extremely beneficial in reducing your pain, particularly in the earlier stages of this deformity. And again, in the worst case scenarios, surgery can be done to address your dorsal bunion. So we'd like to help you, evaluate you, and find out some ways that we can help you feel better. So come see us at the Center for Foot Care, where we measure health by the foot.